ma'am, today. I understand you're having some neck pain. Okay, we'll go ahead and take a look. And I've washed my hands first, of course, and I'm going to note the alignment and symmetry of your neck. I'm just going to look back here and note that alignment from the posterior, from the lateral, and from the anterior. So just sit kind of comfortably. I'm going to note any obvious postural deformities or abnormalities, and just the exaggeration of any spinal curves just as she sits. And then I'm going to go ahead and push on your spine a little bit, okay? Mm-hmm. And you just, if it causes you any discomfort, I want you to let me know, okay? I'm just going to go down the spinous processes and push each spinous process all the way through to C7 and make certain that there's no tenderness. Also, the paraspinal muscular area and also on the facet joints, making sure that there's no tenderness. And then I'm also going to have you do some movement here, okay? So just kind of do what I do. Put your chin down as far as you feel comfortable to your chest. Good, and now you can lift your chin up. Now I want you to look up at the ceiling as far up as you can go. Good, and now come to the center. Now as far as you can look over your left shoulder, go ahead and do that. Good, and now rotate as far as you can to me. Good. And now I'd like you to take, without lifting your shoulders up, I'd like you to take your left ear and put it as close to your left shoulder as you can. Perfect. And now the other way. Perfect. And I would be noticing the symmetry of the movement and also any discomfort during that. And now I'm going to test some strength, okay? So I'm going to go ahead and you're going to push I'm going to just kind of stabilize you here. And I'm just going to have you push your forehead into my hand and let me know if this causes any discomfort. Checking forward flexion. Now I'm going to have you go behind, push it backwards, extension. Good. And I'm going to have you push your head to the side and to the opposite side. And trying to make sure I counter-stabilize here. Now I'm going to do a rotation, and it's kind of weird, but I'm going to ask you to turn your chin and your face right into my hand there, okay? Hard as you can. Perfectly. Rotation. The other way. Rotation. Very good. Now shrug your shoulders up. Don't let me push them down. Perfect. And then we're going to go ahead and do, in fact, the shoulder shrug was cranial nerve number 11, and we're going to do shoulder abduction, which is C5. Put your arms out to the side like this. I'm going to put them right out there. Don't let me push you down. Perfect. And now we're going to go ahead and I'm going to have you do your biceps curl like this. And don't let me pull you down. Good. And what are we doing? C5 and C6. Now we're going to do triceps. And now you're going to extend your forearm into my hand like you were going to straighten your arm. And this is? C7. Good. C7. Good. Okay. Now we're going to go ahead and I'm going to have you take your wrists and we're going to extend them up. And so put them up like this and don't let me push them down. Wrist extension is? C6. Good. And now we're going to do wrist flexion and finger extension. So I'm going to have you go ahead and we'll do finger extension first. Hold your fingers up. Don't let me push you down. Woo. And this one, don't let me push you down. Good. And now turn your hand over and we're going to do wrist flexion. Wrist flexion, thank you. And I'm going to have you kind of curl your wrist up and don't let me pull you down. Good. And same thing. Don't let me pull you down. Perfect. And now we're going to do the finger flexion. And the way we do this is I'm just going to kind of slide my fingers under yours like this. And don't let me pull your fingers straight, okay? And she's flexing hard against mine. Ouch. Sorry. Nails. It's okay. And then you're going to spread your fingers like this. And this is called finger abduction. And what I'm going to do is try to press your fingers together. And I just pick two and do it simultaneously. So I'll do your index and your fifth. And then I'll come and do the two middle ones, trying to push them together. And then really important, I got to get those thumbs and make sure we can hold those thumbs out. So actually spread these. And I'll try to pull the thumbs toward the index finger, so we're preventing, and you're a little weak on that side. And so we're going to check that, the finger abduction. And then I'm going to check your grip strength. And probably best for me to cross my hands, put two fingers in there and grip really hard. Perfect. If you're a little bit nervous that she could grip too hard and hurt my 2 fingers, sometimes 1 finger is a little easier on the examiner, and stick that 1 finger in there and grip really hard. Perfect. All right, now we're going to go through and we're going to do some reflexes, okay? This is my reflex hammer, and we're going to check some reflexes. So what I want you to do is to just kind of not watch me here, okay? And I'm going to, would you just flex your arm for me a little bit so I can find your bicipital tendon? So bring your hand up. Good, now I found it. Now you can totally relax. And I'm going to press in on that biceps tendon. You look over there, and I'm going to hit myself in the finger, or in the thumb, okay? And try to elicit that response. And then we're going to go directly to the other side, because we want to elicit on this side. To find the biceps tendon, have her flex. Good. Now relax. Look away. And we do that biceps tendon. Okay? And you can see it, and you can also palpate it a little bit. If it's a little lighter, you can palpate it. And it should match. And that was a 2+ on bilaterally. Okay? Now we're going to do the brachioradialis. And that is our pop drinking muscle, like this, okay? We're going to do the brachialis through here. And so what we're going to, brachioradialis, and we're going to just kind of have your hand just gently, like you're going to almost roll your hand over, and just let it sit there. Look away, and I'm going to just hit right in that, on that muscle, and we're going to see that movement. See how she kind of tips up like she was going to drink that pop, okay? All right. And on the other side, probably the biggest mistake we do on this is we don't allow them to pronate the hand in a little bit. So we pronate it and hit it. Pronate it and hit it, okay? We're not sure where it is. I kind of hit most of the time somewhere along here. If I miss it on the first time, I'll hit a little harder, or I'll kind of slide upward, because it can be anywhere in here, okay? If the patient has a decreased reflex in those 2 areas, or the one I'm going to show you in a minute, and you can't get anything, as they should be looking away, not watching you, but you can also tell them to really grit their teeth really tight. When they grit their teeth, we can see a little nicer reaction down there, because they distract, and it allows that, they get their muscle contraction up here, and it's a distraction test, and then you can usually get a nice reflex, okay? We're going to do your triceps. Triceps are a little harder, okay? So the big thing that you have to do for me is to just relax, 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 okay? So just let your hand just kind of, and I just sort of stabilize her a little bit, and I just let her make sure she's relaxed, and I'm going to try to get her to about 90 degrees, and I'm going to be striking just above her process and on the triceps tendon, and we should see a little extension, okay? And the big thing is to keep them relaxed. Some people will choose to do these in this position with the hand at their side, and that's fine. The problem is, for me, it would be a backhand here, and it's a little bit more difficult to do. I like it to be out to the side, just kind of hanging a little. So again, get her out to here, yep. And I want you to just clench your teeth really tight. Good. And you can see the triceps contract, and you can see the hand move for them, okay? So that's that one. If the patient, you couldn't elicit that, your last resort, because they couldn't relax enough, the last resort, I won't make you do it, but the last resort is you ask them at the end of this exam to stand at the end of the table, go like this, lay down like this, and boy, did they relax. And then they're in a good position where you can walk around on either side and tap them and get their reflex. All right, then, so we did our triceps, our biceps, and our brachioradialis reflexes. And now we've got to check the sensation, and sharp and soft. And we're going to do this just rapidly with this patient. When we get into our neuro unit, we're going to do this a lot, with a lot more emphasis. But we are going to test those sensations. And I've got soft with this neat little brush, or we could use a piece of cotton. And I'm just going to basically try to hit the major areas, checking one area, dermatologic distribution, to another. I'm going to ask them to close their eyes, and I'm going to say, can you feel this? Does that feel soft or sharp to you? Soft. Good. And so I want you to tell me whenever you feel it, okay, and if it feels the same, yep, or different on either side.
Same. Same. Same.
Okay. And then I kind of catch your hand. You can turn your hands over. Good. Same. Mm-hmm. Okay. Same.
Same.
Good. And I kind of worked my way down through the dermatomal distributions, and you all can look up your distributions and work with this and come up with your own pattern. And then we're going to do sharp. And we've got sharp and dull sensation. Can you feel the difference between this? Does that feel sharp to you at all?
A little bit.
A little bit, okay? Can you feel, does this feel sharp or does this feel dull?
Dull.
Okay. And this feels sharp?
Yes.
Okay. So that's the difference. And I'm going to touch you with each of these in those same areas very gently, and you tell me if it feels sharp or it feels dull, and also if it feels the same compared to one side compared to the other, okay?
Okay.
All right, close your eyes. And you all would want to do sharp in every area. Dull is just a distractor.
Sharp. 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 Dull.
And then once I did dull, I repeat sharp on it to make sure she's got sharp. Dull is just to make sure she's paying attention.
Sharp. 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 Dull. Sharp. 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 Dull. Sharp. Sharp.
Good. And what you want to do is look at your little dermal distribution patterns that we have and figure out how to hit those. And it's just a quick screening. We'll get more into it in neuro, but you want to get a quick screening of those areas and hit those spots. You definitely want to make sure you get to the most distal portion of that spot, okay? So if that nerve comes all the way down to the thumb, you want to make sure you get it all the way down there at the distal end, not do it proximal and ignore distal, because we can have loss of distal. Okay, so we're just doing a real quick, like I said, soft and sharp, comparing bilaterally. And if you were to hit it and it's sharp, you hit sharp, but she said dull, repeat that area and map it out a little then and see where about how much she has dull over there and try to map it then so that in your head you can really know how much distribution is lost in that particular dermatomal area. Now we're going to do some special tests, and we're almost done here. I'm going to have you, if the patient came in and was having some neck pain, I want to see if when we compress, we can cause any discomfort. So I tell my patient, I'm going to just have you sit up nice and tall, and I'm just going to push on the top of your head here a little bit, and you just tell me if there's any discomfort. And I would push down gently with maybe 5 pounds of pressure first. Did that hurt you at all? I'm going to put a little harder on now, about 7 to 10 pounds of pressure. And a positive would be pain. If it was radicular, it might run down that same side. I'm also going to tip her to one side and do the same, and tip her to the other side and do the same. And again, checking if there is radicular symptoms, that would be a positive. Then we're going to do the distraction test, and this is to relieve pain. And so I'm going to say, I'm going to lift up on you. And you're a little bit tall, I think I can do it, but if I couldn't, I'd sit you in a chair and do the same thing. And I'm going to lift upward, straight up like I'm giving her traction. And in a patient with a disc herniation, disc bulge, a positive would be, that feels better, keep doing that. Okay, so that's your positive distraction test. And a positive is pain, less pain. And then I'm going to ask the patient to bear down a little bit, hold your breath really hard, bear down, kind of like how you do if you're having a bowel movement, but don't. Perfect. And Valsalva, positive is pain. We don't tell our patients don't, but positive is pain, and it would go down in the same area of the radiculopathy.
What are we going to be using for like sharp?
Good question. That's okay. That's a great question. What should you use for sharp and soft? Actually, it's a great question. In class here, what I would typically do is you can do a paper clip. What you want to do is have the ends be fairly the same size, because if I use a big dull and a tiny sharp, I can almost feel the surface area different and still know. But what I'll do a lot of times is we'll break one of these little guys, and I will have a sharp there, and just make sure you emphasize this is sharp and then dull is the other side. That's a nice way to do it, a tongue depressor or one of these little pads, a little piece of wood, just try not to give them a sliver. Soft is a little piece of cotton. You can take the cotton tip at the end and just pull it out a little bit, and soft is just brushing it softly. Good question. You ask them, do you feel soft, and do you feel a difference one side to the other?
Is that it?
That's it.